Let's see. Yep, we're
We are
live.
live.
Hello.
And it is it's the last week it was just Alice, but
Yes,
now it's Dr. James and Alice. We're back.
exactly. And you know what? It's so glad to have you. It's so glad to have you back, Dr. James. It wasn't the same. It just wasn't the same without you. It really
Thank
wasn't.
you. Thank you very much. I appreciate that. It was last week was a little bit crazy. Hello, everybody who's jumping in on the Instagrams and on the wherever we are live right now on YouTube, Facebook, LinkedIn, Instagram, and Twitter X. And last week, Alice, I'm so thankful that you could go live without me because it was a little crazy. I was on call at the hospital, and then I
Yes.
left the next day to travel. I traveled all last week. I was in Atlanta at the CDC for a while, and then I was in DC at the ONS Congress, the Oncology Nursing Society Congress. So we're going to get to that in a minute. I'm going to tell you all about it. But thank you for tackling the show all by your damn self last Monday.
Listen, I did the best that I could, but I'm glad you're back. And thank you so much for everyone who's joining us again every Monday, 5 p.m. Pacific Standard Time here on LinkedIn. Welcome to the Dr. James and Nurse Alice show. And listen, it's your two favorite nurse practitioners. We're going to be talking about some of the latest advancements, as well as some of the pressing issues in healthcare today, about a story and a case in, Albuquerque, New Mexico, where the CDC is discovered that there were some cases associated to vampire facials. I mean, that's something that we really got to talk about. But I want to start with the technology piece, James, if that's okay with you, because...
Wait, I want to ask the question. Hold up before you put it on.
Yes. What's the question?
For y'all watching, would you...
Okay, ask them, yeah.
Want to have surgery? Would you trust your surgeon to do surgery on you, to take a part of your body out using an Apple Vision Pro? We want to hear.
Yes. Oh, that's right. Let's there's some comments and stuff. I better get this chat going. I gotta get this chat. Okay.
Oh yeah, the folks is chatting on the Instagrams already, but you got some other folks on your chat too. So we want to hear from y'all wherever you are. If you comment, usually we can see it and we can add them to the screen if we want to. But we want to know: would you let your surgeon perform surgery on you using an Apple Vision Pro, just without knowing anything else? Well, I want to know how y'all feel. Alice, would you let them do that?
Well, medicine is always on the cutting edge. There's always something new. And let me just preface this, because for decades, we've had remarkable technological advancements in the field of surgery. I mean, fundamentally transforming practices that have enhanced the efficiency, the effectiveness, the safety, the precision, and all of these things have improved patient outcomes. So it sounds a little scary, right? It's always scary to be the first. I'll say that, do a couple, then come back to me. But I would say that medicine is known for its innovations, and it's those innovations that actually can improve patient outcomes. So I think we should all be open to it, because although we're going to get talking about these Vision Pros, which I do have, I have to say,
show the people, Alice, that you got the Vision Pro. Let them know. Let them know.
I do have the Vision Pros. I really do. But don't I look like I'm about to go scuba diving? But I have to say this. With the advancements of technology, I mean, James, we're already doing robotic surgery, right? You have things like the Da Vinci surgical system. I mean, these robotic surgeries have literally revolutionized many of the surgeries that are very delicate, that are very complex. The precision, the flexibility, and ultimate control of the surgeon. So we have robotic surgery. We've done minimally invasive surgery. That's your laparoscopic and your endoscopic techniques with doing procedures. I've had that. I've had when I had my fibroids removed laparoscopically. That's how they got to them. Minimal cuts, decreased downtime, decreased risk of infection. I mean, that's something that's amazing, right? We've also had 3D printing. And that's when surgeons do a kind of a 3D printing, so they can kind of get an exact replica on the very small, not necessarily always small, but the very complex structure that they're going to be doing surgery on. So they can, kind of practice. It's like laying out a map the night before and rehearsing, if you will, how they're going to do certain procedures. So that we have that. We also have now this.
I mean, Alice, you bring up some bomb statistics, because someone, our friend Heath in the comments mentioned that they worked with a client who was in this area, and that 26% of all medical errors are preventable surgical errors. So the potential is there for this to really improve patient outcomes, which is what we all about. But as they said, I think this is where I stand too. I just don't want to be the first one to do it.
Okay, well, you're not the first. You're not going to be the first one now because it's already been done, James. So it's already been done. So yes, there is a surgeon. Oh my gosh, don't quote me. Out of the country.
In the UK.
In the UK, he actually did very complex spinal surgery with much success. Basically, and so let me talk about this. So these are the Apple Vision Pro. They are not necessarily economically available to everyone. Your girl dropped a couple bags on this one. A couple.
Let me sip my drink because that's not some chump change. You're not going out to 99-cent store or Target, baby, and getting you some Apple Vision Pros.
So for full transparency, many people are probably more familiar with what was called Oculus, but now are called, what is it, Meta? No, not Meta. What are they called?
I think do they still call them Oculus?
Oculus. There's another name for it too.
Well, there's a bunch of. There's a VR for PlayStation. There's like all kind of.
So those are $399. Those are like $399. You add a 0 to that, and you can get these.
And are they even that much better? Like,
oh baby, please. This is it. These are it. Let me tell you. But before I get to this can do a lot of things, baby. A lot of things. And I believe this is how we're going to be conducting meetings, how we're going to be like, we got FaceTime, but you can actually FaceTime in these things too. You could do so many things. But let me get back to the story. So the story is these, there's augmented reality and virtual reality. So James, you explained it very beautifully to me earlier. Can you tell the people the difference between the two?
Right. Someone just put in here, can it pay my rent? That's what I want to know. Can it?
No, this is the rent. This is the mortgage. This is the mortgage and the car notes.
Correct. And the insurance and groceries and whatever. Right. So listen, okay. So this is my understanding of augmented versus virtual reality. So if there's somebody out there who's like an expert in these things or whatever, please correct us in the comments. Okay. We got some smart folks out there. So augmented reality, as Alice is putting this on. So virtual reality is when everything is virtual that you can see, even though it might look real. Augmented reality is when things that you are seeing in front of you are actually real, but then there are virtual components on top of it. So like the Vision Pro is more of an augmented reality piece of technology where when you're looking at it, it's literally it's a camera taking a live video of what they see in front of you. Yep. So you're actually looking at your couch, your dog, your partner, or whatever. But then augmented on top of that is like your Google Chrome page or a video playing or whatever, something that's not real, but it looks like it's part of your reality. That's augmented reality.
Yes. So actually we have a video. If y'all don't mind, we're going to go ahead and share this video and then y'all can just see for yourselves. And okay, let's see.
It's coming up. Now, speaking of technology, sometimes there we go. Did you get it?
Is it going? Okay, let me do something. While James is elaborating on this, I'm going to pull this video up again just to make sure that
the people's in the comments are saying that I got it right. That augmented is like reality with some like stuff on top of it. And then
yep, here goes.
Virtual. Oh, look at this. We did it.
This is the surgeon. This is the surgeon that did the spinal surgery. You can see that he's actually in a surgery room, so he can see his surroundings, right? He's doing everything with the patient, right? But check this out, guys. Okay, you see what he's doing there. Okay,
this is wild. This is
in the room.
wild.
I literally can see what's in the room with me, but at my discretion, I can pull things up. See that? I can pull screens. So the surgeon can have your MRI, your X-ray, your medical chart, the football game. They can have anything up that they want to see. Or
not the football game, Alice.
Sorry, no, but I'm just saying, like, they can actually have other cases or similar, like let's say they're operating. I don't know what he's operating on the spine, obviously, but he can have other photos of the spine, anatomy, different things, different techniques that other people use. But all of these resources available to you while in the room, while you are the center of focus, but having these resources right up at them. And if I'm correct, 10 screens up at the same time on here.
Yeah, you can have all kind of different screens up there. I mean, listen, theoretically, not even theoretically, this dude is doing it right here. We're seeing it happen, right?
Yep.
And the spine is such an incredibly sensitive place. There is very little margin for error. So if if you have a surgeon who's got an augmented reality field, right, a field of your MRI. So he's looking at it, and then the MRI also said, oh, it was, in C7 or whatever, and it was XYZ nerve. And okay, so you're matching up the information from the MRI and you're matching it with what you're seeing. And you're like, wow, okay, I want to make sure that I get to X, Y, and Z. Like, I can see that theoretically how this could be a tool to help surgeons and help other folks. But I'm with you. Some folks in the comments are like, listen, no distractions, please. I don't need you looking at my spine with a knife, with a laser. And then also looking at some screen, looking up, how do I do this surgery? Come on, surgeons on YouTube. Wait.
Okay, let's have a transparent moment of what happens in the OR.
Oh, they're very distracted anyway.
Yeah. The surgeon's going to stop anyways to turn around, walk to the radiology film that's hanging. So rather than them stop and walk away from you to go there, they can have it literally up there with them. They can literally take one photo, overlap it on another photo for to help assist them with precision and making decisions in a split second. Because the time it takes for them to walk to the radiology film or look on the computer at the MRI and come back to you, that's minutes. That's additional time that you're in surgery, additional time for potential complications. So I get it. It can be scary. We don't want people to be distracted. But is it really a distraction if they are tools that are assisting the surgeon in completing the task in front of them? It's going to help them faster, more precise, have more. It's like taking a test and having all your notes right there. Like, we're going to get 100% on this test. That's what we finna do.
I mean, that's a really good way to think about it, Alice. I hadn't thought about it that way. Like this, it's like taking the test, but with your notes are there at the same time with you, like your study notes, so that we can pass the test. I see the value in it. I just, here's the thing. I wonder if we.
Oh, cute.
Now, Alice, do you know they're asking on Instagram? Sorry to interrupt. They're asking on Instagram. Do you know? Can this record?
Absolutely. Okay. Yes. The answer. So. Okay, about the surgery. Okay, we talked about the surgery. What else can I do with this? I can FaceTime. I can do my Zoom meetings. It can record the screens in front of me. I can literally, and then I'm typing in the air. If I pull up my email, I literally can type in the air like this. There's no handhelds like the Oculus. Everything is touch. I can swipe up, swipe across. Like, I'm gonna move this screen over here, move that screen over there, and
not you doing Minority Report, right? And you remember that movie with Tom Cruise? He was all swiping and typing and doing all this stuff.
What it is. That's exactly what this is. So you're on here like, and baby, look, you can be in the kitchen. I mean, well, hold on. Safety first. Let me just make sure. Like, you can wear this. You can see what's in front of you, but also we have to also just be aware that we're still human. We might make errors, but literally I can be in the kitchen cooking, and I can have this layered where I can literally see what's in front of me, and then have the recipe book up here, have the TikTok video where I saw the lady making it here. I can have all of this up. Swipe screen with the touch, like, just I'm moving my hands. I don't have to have a controller or anything.
So I'm gonna take it a step further for you, Alice. Though we're about to get a little deep here, because in the comments they're bringing up some real stuff.
What are they saying? So
how do we collect data over time to refine the technology? Are people open to having their surgical data collected? Like, do you think that as patients, do you think that there will be patients that would be open to saying, hey, we want to use this? Not only do we want to use this on you, but we're going to record the whole thing so that we can use it as a tool to teach others how to use this, and to teach our students and residents and nurses and whatever. Like, this is where things start getting a little fuzzy, because it may be like, I agree to allow you to use this tool. Or does someone have to consent to that? And then in the consenting of that, are they also consenting to using a recording of that? Like, that's a really interesting point.
You do it now already. Boom. You do it. You sign it already in your consent. There is a picture when you sign your consent. You'll have to look at your consent specifically, because I'm not an attorney, but I have participated in enough procedures to know that when you are consenting to things, there's actually a line that asks you if the whatever the opportunity can be used as a teaching opportunity for someone else. Can we record? Can we take pictures? And unless you've proactively opted out, baby, you is in. We already been doing this.
And I think so many people, Alice, don't know that. I want to know, just not mic drop. I literally have my microphone here. That probably was loud. Sorry, not mic drop. But I think so many people don't realize that when in that fine print, you know, the surgeon comes in, or oftentimes it's an NP or a PA or the nurse on the team, whatever, and they come in and the surgeon will answer like 2-3 questions and then they run out. And someone else is in there with you answering all those questions. But ultimately, when you go to sign that consent form, all that fine print in there is you consent to allowing us to capture some of this data, to record some of these things, to have students in there, to have people who are not the surgeon do things to you within the scope of their practice, right? I think a lot of people don't realize that they're consenting to this. So then I wonder then if these patients that had this Vision Pro used on them already even knew that it was happening.
I imagine that was probably something that was consulted with the hospital's legal team. The patient was probably I'm pretty sure they were made aware because this is the first, right? Let me say this. I can't say that these are medically approved, or excuse me, if there's any, I don't know if there's been like a true body to medically approve this for surgery, but as you know, we have to do research. Someone has to volunteer. So it has to be a study group. So this patient probably was like, I'll do your surgery for free if you let me do it with the goggles. I'm making that up.
Maybe my husband is crazy about technology. My husband would probably jump at that. He'd probably be like, oh yeah, you're going to do the surgery with the Vision Pro? Yeah, go on ahead. Like, I'm into it. Whereas I'm the opposite. I'll be like, nope. I want grandma who has done this. She has done this surgery for more years than I've been alive. I want her to know the inside of my body without even looking at it because she done seen it so many times. Like, that's what I'm one of those. I'm like, give me old school ride or die. You're going to take something out of my body. I want you to have done it. But that's why they
have done it. They're just advancing the technology. And let's just think about this way, James. I'm sorry to cut you off, but the way we got to robotic surgery, the way we got to laparoscopic surgery, the way we got to 3D printing, even also laser surgery, telesurgery, all of those things is because we were building on things that we'd already done. There's no way we could have gotten to this if we hadn't done robotic surgery, if we hadn't done all those other things. So I believe that this is evidence that the science is getting better, the technology is getting better. All of these things, it's getting better. It's getting better. Just imagine for all the people who had, I don't know, let me say the block cell phones. Eventually they switched to a flip phone. Eventually just like cell phones and technology, look how advanced the cell phone has gotten. Things get better over time. Obviously, is anything perfect? Absolutely not. Will there be cases when these are used and something doesn't go as well as planned? Probably so, but that happens just with other surgery as well. I think the more we use it, the better we get.
I love your optimism about this, Alice. I think it's great. Because listen, you're right. There are so many technologies that we all benefit from, and there's so many technologies in the medical space that you're right haven't happened. Though some people in the comments have brought up some really interesting things. There's certainly some hesitation in particular communities, right? Because so much of even gynecological care is the one that's getting the most media attention right now. Most of what we understand, which granted isn't enough, about the cisgender like female body is through experimentation that was done without anesthesia on Black women at the turn of the century. And, our understanding of syphilis through Tuskegee experiment, all these different things, what we know about genetics would not be where we are right now without Henrietta Lacks, whose genes were taken and still studied to this day in labs without her consent, without her knowledge. So I think some of this too, the lyric of this is like, yes, we want these medical advances. I want you to be as safe and efficient as possible. I want you to spend the least amount of time in my body as possible with the least amount of medications, right? We want to do all those things. But to get there, we're going to need some folks who are ready to get paired with the Vision Pro. And Tim Scott. What about Tim Scott? I want his ass to get surgery with this thing. That's what I want. So not Tim Scott. Who am I saying? Yeah, who's the guy? Who's the Apple CEO? Tim Scott is a politician. Who is the
No,
damn?
I don't even
Tim,
know.
what is Trump? Trump calls him Tim Apple.
Tim,
what's
well,
what's the
I
guy?
I don't know his name. I don't know.
Tim
But
Cook. Oh my God, Tim Cook. That's
okay,
right. I
oh,
had to look it up.
you sound like a singer. Sound like a country singer. But anyways, let me just leave away with some key points to this before we pivot to our next story. So, I mean, the Apple Vision Pro, it integrates augmented reality to provide real-time 3D imaging and enhancement of surgical accuracy and outcomes. The surgeons, granted, this was the first surgery, but I guess there have been practice and simulation situations. Surgeons have reported improved visibility and precision, attributing to faster recovery and reduced complications because of the technology. The patient, there's a patient impact, right? The patient experiences a quicker than average recovery period because they're down long for shorter periods of time because the surgery is shorter, they're more accurate, minimal discomfort with improved surgical results. And so the future implications of this may eventually be the standard surgical procedures one day. I mean, but again, potentially reducing operative times, complications, and those type of things. And we get it. We're going to be collecting data. What y'all didn't know is that they were already collecting data on y'all because y'all was just signing the consent.
Right, that part.
But we do. So, and like, look, Apple Watch. When this watch came out, it couldn't do all the things it does now. It can read EKGs. It can give me my sleep hours, my heart rate, activity. It can measure, like, if I fall down, like, are you okay? Like, no, I fail. I'm not okay. But it can tell you these things. So that kind of technology, obviously, we collect data, we look at the data, we look at what we're doing, and we make improvements. So, I get it. It's a scary thing, but the Apple Vision Pro has shown a 30% improvement in surgical precision and a 25% reduction in surgery time across tested procedures.
Wow. All right, put it on one more time for us, Alice. Yeah,
No,
listen, this is
let me model.
America's favorite nurse, Alice Benjamin. What happens if you walk into one of your patient's rooms just wearing that?
You know what? I should probably try it, huh? Oh, but here, I should probably try that. Everybody look at me like I'm crazy. I'm like, this is PPE. They wouldn't have they wouldn't even question me. I put his hairnet on, like, this is my new PPE.
Hey, you know what though? I think about the implications of, like, during COVID, if we had something like this, we probably could have done some different things. Maybe they could have been supplied to patients who were in the room so that they could see their families easier, because sometimes even patients weren't even like able to like hold up phones for FaceTimes or whatever. They could also, like, you could have a FaceTime conversation with the patient and then therefore not exposing healthcare workers to COVID right before, especially in all those places. Now, listen, if they didn't have enough money to afford PPE, they probably weren't going to have the money to afford Vision Pros for the patients. But just theoretically, this could really be a safety thing, protecting us as staff as well.
Exactly. And so I do telehealth as well. There are times where I probably won't even need my laptop anymore. I'm just going to put this on. Mr. Jones is going to put his goggles on, and I'm going to talk to him about what's going on. And I'm going to pull up his x-ray results and say, look, you see this part on your kneecap? This is the part where they need to do surgery. I'm going to refer you to the surgeon. I'm going to go ahead and type the note in there while I'm talking to him. Like, this is it. This is your walking computer. Just like we learned the iPhone became your walking computer. Taking pictures, taking videos, collecting data. You can do all those things. You can do everything on the iPhone that you can do here. You can even talk to people like a regular phone call. You can FaceTime on here. So anyways, that's my spiel on Vision Pro all the way.
I love it. Wait, is Tim Cook? You're like on the PR team. You should be on Tim Cook's PR medical device team. That
Yes.
America's favorite nurse, Alice Benjamin, going out and talking about this device. Because listen, the thing I was going to say, Alice, and you beat me to it, was, for me, being a data guy, the proof's got to be in the pudding. Like, I got to see the numbers. You have to tell me, as such a research head, as someone who was like, I need to know where this is, and trying to remove emotion from it. Mm-hmm. If this thing is improving patient outcomes, if this thing is reducing surgical errors, which happen a lot more than we talk about, if this thing is making us as patients safer, mm-hmm. then I have to be for it. Whether it's going to make me uncomfortable or not, I guess I got to get on board.
Okay. And that's all. Just be open to it. Just know that these things are happening. So if your provider walks in the room one day and you're like, Oh, okay. Apple Vision Pro, you're on it. Okay. And these might be questions you can ask because again, you can, and just imagine if you have this on and your patient has it on as you're doing that visit. Well, look, here's your x-ray and let me show you what's going on inside of the heart and be able to draw on that literally with the patient.
Yeah.
That'll improve communication, education, get everybody on the same page. But
that's fascinating. I love it.
That is the Apple Vision Pro. Now we're going to pivot, James, because there's some equally important. I wish this was more positive news, but it's not, because it's about a real serious public health concern that has emerged in Albuquerque, New Mexico, where multiple clients have been exposed to HIV following what is supposed to be a beautification process of the vampire facial treatments at a local clinic. So, yeah, and you know what? Side note, I didn't get a vampire facial, but I did have some type of laser or something to kind of tighten this up so I can continue looking young. But that's scary. You're going in there for an elective procedure thinking, that you're going to just come out on the other side looking just more beautiful. And you come out potentially exposed to HIV. James, I'm gonna let you take it.
And not even knowing, right? There are now 3 more people living with HIV in New Mexico because of errors made at an unlicensed, unregulated medical spa in New Mexico. And I think that's a really, really important point. So for y'all that maybe don't know, these vampire facials, what they do is they take your blood, they spin it in a centrifuge, and it separates out into all its little components, and they take the plasma and they re-inject it back in you in a bunch of little microneedles all over your face. And it stimulates collagen growth. And you get the plump, firm, yummy skin. It's, the Kardashians made it famous. And it's been around for a while. Well, in 2018, there was a case of a woman who had no other risk factors for HIV. And we don't like the word risk, but for this conversation, had no other factors potentially exposing her to HIV, but she found out she converted, that she is now someone living with HIV, that she's HIV positive. So they were able to trace it back to these, and Alice, I want you to pull up the video here because I think the video does a really great job of this. They were able to trace it back to this med spa clinic where she got this vampire facial in 2018, and the CDC and the New Mexico State Department of Public Health have been investigating this since 2018, and the CDC just basically now came out with their final report about what actually happened in the last couple of weeks.
Detailing what it says are the first known cases of HIV transmitted by so-called vampire facial injections. Have you heard about this? The agency is detailing 3 cases where women ended up being diagnosed with the virus, most likely after getting the treatment at an unlicensed spa in Albuquerque, New Mexico. The first case came up in 2018. Then another woman tested positive for HIV a year later, and a third case just last year. In a joint investigation by the CDC and New Mexico's health officials, investigators say they found a rack of unlabeled tubes of blood on a kitchen counter and in the fridge at the spa next to food and injectable anesthetics. They also allegedly found unwrapped needles in drawers, on counters, and in the trash can. Investigators say dozens of clients may have been exposed to.
Wow.
Dozens of clients were probably exposed to this. Now, the CDC has come out to put a little button on that story. The CDC has come out and said that they have only found those 3 cases so far, but that the investigation into this still is a little bit ongoing. Yeah. This is. So listen, I feel like I need to just level set a few things. I never, ever, as an ambassador for the CDC's Let's Stop HIV Together program, I never want HIV to be something that people are fearful of anymore. This is not at all to be fear-mongering. Alice and I do this every Monday and do all the things that we do in terms of education. So these people are living with HIV now. If they have the means and resources, which a lot of people do now, we think HIV is like a chronic condition. I speak about this all over the nation, on television, in lots of different arenas. And I often tell people that now with the medical advances and technology like we're talking about that we have, HIV is, for most people, not the thing that's going to kill them. They're going to die at 97 in a car accident, right? Like HIV is not the thing that's going to take you out. because we have the medications to be able to have people lead healthy, full, long, active sex lives, all of the things. Okay, so this is not a fear-mongering thing. What this is, though, is education about where you get your stuff done. So it is so incredibly important before you go get anything done, a cosmetic procedure, an orthopedic procedure, you get your nails did, like whatever you're going to do, that you actually do some research on where you're going and make sure that they have at very, very least a license. This place was not even licensed, Alice.
I know. You know what? Although this is a little bit of a separate topic, I won't deviate too far, but when we talk about medical tourism, sometimes people are looking strictly at prices when it comes to the treatment and the services that they're getting. While I understand the economic impact of, the dollar, you want something for less. We all do, right? We all like free 99. We do. But when it comes to your health and safety, those are things that are priceless, really priceless. And so you need to do your due diligence and balance the price and cost of something versus making sure that they are licensed, accredited, that they're clean. You've checked out the provider. You've looked up the provider online. Do they indeed have a medical license? Are they doing, I don't know, are they doing some type of procedure on you when they're licensed to do something else? For example, if they're supposed to do something with your face in dermatology, but maybe they're a podiatrist. Not saying that they can't cross-train, but you need to ask these questions. You need to ask, how many cases have you done? Have there been any complications? If so, what are they? What happened? Without them having to disclose who the person is, they should at a minimum disclose to you the pros, the cons, potential side effects, adverse effects, and what are the percentages of infection, death, hospitalization, and those unwanted things, because you're going there to get beautified, right? And then you're going to come out with something else that you didn't really sign up for. And James, even with getting nails done, you got to make sure that those, the people who are doing your nails are opening up a clean, sterile equipment to use those on your nails. You might think, oh, they're just cutting the cuticles. Listen, there's fungi, there's bacteria, there's viruses that, live on every surface of our body. There's each of those are especially places in which multiple people frequent for their treatments and their services. The potential for contamination, cross-contamination, all those things exist. So you gotta be careful, James. Gotta be.
You really do have to be careful. And even I always tell people too, don't be afraid to be the person who is like, hey, can I see your autoclave, which is the machine that they use to sterilize? Can I see how many infections have y'all had in the last year? How many people have return visits? Even if you want to be a little bit sneaky, you're like, oh, what's your return visit policy? How frequently do you see people come back? Like, are people needing to see you? Whatever. Like, what types of scarring and things can I do this? Go read Google reviews. Go read Yelp reviews. Like, a lot of times we hear I call it the 10% rule. So the 5% of people who have an amazing experience and the 5% of people who have a terrible experience are the ones who are actually going to say something about it online. But you can get an idea if somebody has 1,000 reviews and 897 of them are terrible. Like, maybe pick a different med spa. But all of these places that are required to have licenses, you can Google and find their licenses and certifications online. Every single state requires that. So to your point, Alice, yes, we all want free 99. We all want this to be as cost effective as possible, but do a little bit of research before jumping into something like this. And just like you said, Alice, if you're watching these people and they're not using brand new needles every time they're about to do your micro needling, if they're not using brand new equipment, whatever, just get up and leave. It's not what
that right in front of me. I'm sorry.
Please. Yes.
Although that probably is new. I need to see you open the package. Can you show me the package in which you opened it from, at least something to that effect? Because, and I'll say this: most providers want to do right by their patients. Actually, I think all of us do. Why some deviate from the process, I can't really explain that mindset. But there's not everybody's family. There's a crazy one in everybody's family. There's a crazy one in everybody's profession. I'll just go ahead and say it. But
that's true. That's true.
To make sure you don't have the crazy one, you need to do some questioning and investigation. And I'll say this, depending on the procedure you got, obviously these folks got vampire facials, which can be done in clinic, right? There might be other procedures where you have to go to a surgery center and all those things. You need to inspect the location more than just the receptionist area and then where you're sitting, you know, in those common hallways. You can ask before the procedure, where am I going to be doing this? What does it look like? After the story, I might be like, can I see y'all refrigerator?
Yeah, right. I want to see your autoclave. And listen, if they don't let you do it, go to a different one. And I think one of the biggest distinctions too that people might not realize is that there's a lot of places who will advertise and look and feel, especially on social media and in a bright, shiny website, like they are medical grade with licensed professionals. And they will look like that. And that is the difference between a med spa and like an aesthetics clinic, like a dermatologist clinic or a plastic surgeon's clinic or someone who specializes in aesthetics. So it's just like Botox, for instance. Botox is not very well regulated. And so you can have someone who has just been trained by their friend on how to inject Botox, or you can have someone who is like a licensed professional, like a nurse practitioner, who knows where the nerves are to avoid in your head to inject you in the right place. But those two people's Instagram feeds and their websites and their advertising can all look and feel exactly the same. Mm-hmm. So you're always looking for that person who is like a registered, licensed, certified clinician, and not just they went online into some website, getcertifiedhere.com, but that they went to a school and were trained and that they are RN, NPPA, or, you know, an MD or DO.
Right. You definitely got to do those checks. Now, James, if I could just circle back, because again, you're the CDC ambassador when it comes to HIV. Some people may have some questions about, you described how a vampire facial happens. Mm-hmm. Spin down the blood and they take, is it the plasma they take and they put it into the, so yeah. What is the likelihood of transmission of something like getting HIV through something like that? Even, let's say, well, first off, my question is, in the story, they found some of the products in the same refrigerator as their food. And they also found some things that were unlabeled. So whenever I'm doing any type of procedure that's related to blood, bodily fluids and things, what should I do as a consumer? So, I mean, they take the blood, they take it somewhere and spin it. I mean, should I be watching them every single, like, where are you going? What you doing?
I mean, I think that would be nice. I've never done this. Yeah, I've never done this before, so I don't know if the centrifuge where they're spinning the blood before they do the vampire facial is
probably should be
something that they do in front of you. Okay. I think it would be a smart practice for people to do that. You know, the likelihood of transmission for something like this is about the same as anything else that requires a needle stick situation, because, you know, I want to be really clear here. This is your own blood that they take, they spin, and they put your plasma back into you. So they're not using other people's plasma. The issue here is they were reusing the tubes that contained the whole blood products in the first place that they spin in the centrifuge. And they were reusing needles that they had used on somebody else. Now, the HIV virus is very, very fragile. So when it is exposed to air, when it is exposed to other elements, viruses are not alive, okay? They're not living anyway, but the virus will like decompose. It'll fall apart fairly quickly. So what that means is that they were probably using those needles on several people in a row very quickly. And the people that they had used it on right before probably were living with HIV and had a higher viral load. So plasma in and of itself will have some retained blood products that then make it easier when you're, you know, doing hundreds of small injections on the face. So imagine you use a needle that's already got a little bit of blood in it from someone else before you. They just shove your blood into that needle and then they just poke it back in your face. So you're getting that other person's blood too, or the person before them and the person before them. So this is rare, by the way. This does not happen. Generally speaking, microneedling is very safe, but we do see different outcomes based on where people get it. So if you're getting microneedling from a plastic surgeon's office, from a trained NP or PA, from someone who is licensed and certified, we see almost no issues with this whatsoever.
And oh, go ahead, James.
Well, just when you go to any old med spa, Joe Blow, fish and grits, and microneedling down the street. Yeah.
Fish and grits. I like fish and grits.
That's what I'm saying. And but I'm not getting my vampire facial at the same pace I'm getting my fish and grits. Just saying.
True indeed. Although it would be convenient, but no, don't do that. Because I'm like, I don't get to get in the car and go nowhere. It's all here. All right.
You're like, wait, you finna beat my face while I beat this food?
There you go. Exactly. But also, I also want to mention this. With these clinics, I think so. There's two things here. There are people who are maliciously doing things that are wrong. And sometimes there are errors that are made because you perhaps hired the wrong person or, and that's why it's very important for people to be medically trained with certain things because usually, right, the healthcare provider, what's a physician, nurse practitioner, or PA that's doing most of this work, right? The licensed healthcare professional, they may have a team working with them. Are these medical assistants? Are these interns? Are they just, the homegirl who's off today who needed to just pop in and help? So I don't know for sure, but I just want to throw this out there for consideration that perhaps it could be that there was an unlicensed person working in the clinic who did not have a good concept or understanding of infection control, biohazardous waste, bodily fluids, and disease that can be transmitted through them. It's not good excuse for the overall thing, but sometimes that's how things happen. Clinics are very well intended. They have their protocols and procedures, but then it just takes one person to make that error mistake. So I don't know. I'm just out there for
I agree with you and sometimes when there are like one-off errors or like sentient events that we talk about in the hospital. Yeah. But this happened 3 times over 4 years. That is a process and a procedure. That is a whole ass clinic that is just not giving 2 F's about
somebody
safety.
in there slept in class. Somebody slept on that subject. I don't know. I'm not making excuses, and it's not a funny matter. James and I were just throwing some bantering, but if you don't somehow insert some type of humor when you talk about this, you're going to want to cry because these are people's lives. Their livelihood. It has a great financial, emotional impact on someone's life.
Absolutely.
So the reason why,
and again, this isn't like, it's not like a death sentence, right? Like the individuals who are able to access and take HIV medications, which a lot of people are now, live long, healthy lives. Their lifespan is actually considered normal when you take your medications and your viral load is suppressed. Like, honestly, we're at the point where living with HIV, if you are able to take your medications, most people, it's not even the thing that worries them the most about their health. So hopefully that is the case for these individuals. But yes. Alice, I think you said it before, like, we're living in this world right now where like any old body can just open a med spa. And then these are the ramifications of people being able to do these types of things like microneedling procedures, interacting with other people's bodily fluids or whatever. And then these are the outcomes when you don't have people who are licensed and certified and all that kind of stuff. It's a really difficult and tragic story. And I'm glad that the CDC is making this known and aware right now so that people can just be educated, because there are wild numbers. It's something like above 70% of people have either had or are considering some sort of like aesthetic procedure. So whether that is a plastic surgery procedure or a liposuction or something like microneedling or something like that, these are big business. And that's why you see these unlicensed, unregulated clinics trying to get into it, because they want a piece of that pie.
Exactly. And, I'm not to incite fear or anything like that, but if you are someone who's had any type of, maybe you've had a similar type of procedure, and just to be on the safe side, it took several years for the CDC and the new Albuquerque public health department to figure, to come to these conclusions.
Right.
It doesn't hurt to call your provider like, hey, I heard this story in the news somewhere in another state, but just curious, have there been any reports or cases in your clinic? Has anything happened? Listen, I would like, hold the phone here. Hello.
Alice
Yes.
said, I will call. I will call.
His story. Hello. Who's boss? Who's office manager? No, right now. But I'm just saying, you know,
like,
you
this
have
is the
to advocate
office
for
manager.
yourself. You do have to advocate for yourself. So again,
100%.
many of us, I'm going to say all healthcare professionals want to do good. We want to do good. We want to do right by our patients. We're not perfect. Sometimes things slip through the cracks. Sometimes we don't find out. And then sometimes there's that small amount of people who like, what happened? Shh, don't say nothing. You think, come on, say something, then we'll do it. So hopefully that's not a type of provider you've received services from, but to prevent years from passing, it doesn't hurt. They shouldn't find offense to it that you want to call and check and say, hey, there's this nationally trending story about HIV transmission from a particular procedure. I want to know, have there been any instances in your clinic where there's been some type of infection control breach?
Yep. And they will, and a lot of these things have to be reported too. So if they don't tell you, you can go on the interwebs and find out for yourself. It's
supposed to be reported. It's supposed to be. And for the most part, it will be, but sometimes stuff isn't, or it's reported much later. So be your best advocate. Be your best advocate.
I love it. Alice, America's favorite nurse, Alice Benjamin. First of all, listen, you brought the heat. I think everyone's loved both of these stories. I think they're super important, but you brought we
brought video today.
Yeah, and you brought video both times. Listen, the controversy over using Apple Vision Pro, put them back on to do surgery. We got all these folks in the who just joined the live too. Sorry, y'all, we're about to sign off. But, today we talked about using Apple Vision Pro like Alice is doing to perform surgery. Would you let a surgeon do that on you? And what does the data say about that? And then, of course, the CDC just released their final report on those vampire facial cases where 3 individuals are now living with HIV after receiving vampire facials at a clinic an unlicensed, unregulated clinic in New Mexico, and how you can avoid that happening to yourself. Folks are already saying, thank you, Alice. We thank y'all for tuning in. We definitely want to know what y'all want to talk about. So we feel like we know the stories that are interesting or whatever, but we definitely want to talk about you guys. In fact, I think we should do this for next time, Alice. We do have someone in on LinkedIn, by the way, who was like, what about eyeball syphilis from using makeup testers? And I like that as a cliffhanger because we definitely should talk about, because I'm a Sephora girly. So don't get me in Sephora putting damn thing on my face. So I think we should absolutely talk about that next time.
Well, I think that's a good story. And I have, in the emergency room, we see a lot of things. But what I've seen a lot about recently are people in these, and I always forget how to say it, the lichen toenails, the very thickened toenails that are like this. People are like, there's Alice. What's it called? Is it called lichen? It's the thick toenails that are like the fungi thick toenails that are like. I think I have a picture. I think I might need to show this picture.
Like, she said, I'm pulling it up. I mean, we can talk about that too because, baby, never mind.
Well, anyway, let me ask this: what are some topics you guys want to hear? How about you guys drop some of those in the comments? Did they?
Yeah. Because some folks will put them on the comments. But you can, while you do that and while we wrap here, if you are watching on my platforms at Ask the NP, please go follow Alice. She is all over social, everywhere at Ask Nurse Alice. And if you're watching on Alice's, America's favorite nurse, Alice Benjamin, y'all come over and follow me at Ask the NP. We do this every Monday. Usually it's both of us. Last week it was just Alice. She hooked it up. Someone put Fritos in here. Y'all want to talk about Fritos? By the way, Fritos.
He was eating Fritos just a couple seconds
ago. I was eating. At least they were baked. But anyway, so we definitely want to hear what you have to talk about. Drop us a note, drop us an email, slide into the DMs, all of the things. Leave a comment on this video, and we will be back with y'all next Monday at 5 p.m.
Okay. Yes, we will. And then also just.
I'm sexy, do your dance. Get it sexy. Get it sexy. Get it sexy. Get it sexy. Boy, you know this ass super fast. Fuck me good, I'm throwing that shit back. He wanna kiss me all over my tag.
Wow.
Okay, that was enough. That was it.
Wow.
I think I was expecting that, but I think that was a good kind of.
Look, she cleaned him up. She got him cleaned up. I love it.
I was cleaned up. But I have a lot of people who come in with feet whose toenails look like that, but it's not just what they look like, but it's also hurts. So they're always asking, what can I take? What can I do? And I think that's something that's worth, because you're on your feet all day, right? You are. How do you wear tennis shoes? How do you function? Because if your feet hurt, how can you? It impacts your mobility, your ability to concentrate, so much more than what is directly impacted on your feet, and more than just being cute. Yeah. So you saw them.
Love it. We doing it next time. Eyeball syphilis and funky toenails. And whatever else y'all want to talk about. We appreciate y'all so much. Stay tuned. We got more coming. We'll see y'all next week.
See y'all next week.